Okay, let's dive into this. Kidney stones. Honestly, just hearing those two words can make some people visibly wince, right? It's an incredibly intimidating medical topic, and since more than 1 in 10 of us will deal with it at some point in our lives, understanding it is absolutely crucial. Today in this explainer, we're going to look at some really fascinating data and insights from the Cleveland Clinic to help demystify the whole process. We're going to break down exactly how modern medicine tackles this issue step by step and turn the unknown into actionable knowledge.
You often hear it called exactly this, the most painful condition on earth. It's a dramatic question, for sure, but that intense fear surrounding kidney stones is very real for millions of people. And honestly, for good reason, considering the incredibly delicate anatomy involved. But we're going to pivot away from that fear right now, because here is the good news. By understanding the highly structured treatments available today, we can drastically reduce that anxiety. It's all about knowing your options and realizing that urologists have a very specific, carefully designed medical playbook for this.
So, what exactly are we dealing with fundamentally? The Cleveland Clinic gives us this very straightforward definition. A kidney stone is a solid mass formed from substances in the urine. But what's really interesting about this is how such a remarkably simple definition leads to such complex biological challenges. I mean, we're talking about microscopic, crystallized minerals, things like calcium oxalate or uric acid. They start out so incredibly tiny, literally microscopic crystals, just floating in your kidneys. But when your body doesn't properly dilute and flush them out with enough water, they start sticking together. Layer by layer, year after year, these tiny crystals accumulate into a hard, stone-like object that eventually gets trapped in your urinary tract. It's wild to think that something causing so much agony starts out smaller than a single grain of sand.
To see how doctors handle this, we're going to look at a 4-step escalation arc: observation, shockwave lithotripsy, ureteroscopy, and percutaneous nephrolithotomy. It's basically a toolkit that moves from the least invasive approach all the way up to advanced surgery. Let's start with option 1, observation. So, the crucial point here is that sometimes doing absolutely nothing medically is actually the best medicine. This is widely known as the watch and wait approach. If a stone is manageable, doctors will often let your body just do its thing, allowing the stone to naturally move through the 4 distinct stages of passing. First, it has to dislodge from the kidney. Second, it travels down that incredibly narrow tube called the ureter. Third, it enters the bladder. And finally, it passes out of the body. Think of it kind of like plumbing physics. To flush debris through a very narrow pipe, you need a tremendous amount of pressure and fluid. That means this approach requires strict medical supervision, massive amounts of hydration, we're talking liters of water, and a whole lot of patience during what can be a pretty grueling waiting game.
Now, doctors aren't just blindly watching and waiting, they're constantly calculating. They carefully monitor specific factors to see if this natural option is still viable. And size absolutely matters here. For instance, stones in that 5 to 10 millimeter range represent a really critical threshold. A 5 millimeter stone, it has a decent chance of passing naturally, often over a 50% success rate depending on its exact shape. But as you get closer to that 10 millimeter mark, the probability of it passing on its own drops drastically, almost down to 0. They also look at exactly where it is in the ureter and the total time it's taking to pass. If it's causing a dangerous fluid backup or a total blockage, well, the waiting game abruptly ends.
Let's move to and see how this builds when observation isn't enough. Option 2, shockwave lithotripsy. Lithotripsy is a pretty complex-sounding medical term, but in plain English, it just means breaking stones apart using targeted sound waves. I want to reassure you here, this is still very much a minimally invasive procedure. There are absolutely no incisions. Instead of a scalpel, your doctor is basically using the principles of physics by shooting sound waves from outside your body. It sounds a little bit like science fiction, right? Using invisible energy waves to break a rock hidden deep inside your abdomen. But it's an incredibly common standard practice in modern urology.
Let's walk logically through how this works because the mechanics are really fascinating. Step 1, doctors use X-rays or ultrasound to precisely locate the stone inside your kidney. Step 2, they apply focused, high-energy external shock waves directly through your skin and tissue right to that pinpointed spot. And step 3, over the next few days or weeks, you pass the smaller fragments naturally. The entire success of this depends on those sound waves pulverizing that dense mass into fine sand-like pieces. And understanding why turning it into sand is so crucial really puts things into perspective. Passing a 10-millimeter jagged rock is going to tear delicate tissue and get stuck. But a handful of sand, that can easily wash out with your normal urine flow without causing major trauma. Which brings us to option 3, ureteroscopy. But what if the stone is just too dense for sound waves, or it's located in a tricky part of the pelvis where those shock waves can't safely reach? That brings us to our third escalation, and this brilliantly illustrates what happens when sound waves won't cut it. We move to a much more direct, hands-on approach. We are literally going in with scopes and lasers. It's still categorized as minimally invasive because, again, there are no surgical incisions made through your skin. But it is undeniably a major step up in direct physical intervention compared to just external shock waves. Here are the specifics. The doctor carefully guides a long, tiny, flexible telescope, the ureteroscope, up the urinary tract to get direct visual access to the stone. Once they have eyes on it, the technology gets pretty amazing. They use a highly specialized laser to carefully dust or break the stone into tiny pieces, and then they pull the larger fragments out using microscopic baskets. It's a literal feat of microengineering happening right inside your ureter. Also, a vital detail you should know. This procedure very often involves the temporary use of a ureteral stent. That's a small, soft plastic tube left inside you for a few days to a week. Its whole job is to keep the ureter propped open and reduce swelling while your body recovers from the laser work. While the stent can sometimes cause a weird, crampy sensation, it is an absolute lifesaver for preventing blockages after the procedure.
Finally, we arrive at the top of the ladder. Option 4, percutaneous nephrolithotomy. This is the absolute highest level of intervention on our agenda. The true surgical solution. When stones are massive, doctors have to turn to this advanced procedure. Sometimes kidney stones can grow so large, they're actually called staghorn calculi, meaning they literally branch out and take up the entire inside architecture of the kidney, looking almost like the horns of a deer. Scopes and sound waves simply will not work on something that massive. So this surgery requires a small incision in your back. The surgeon creates a direct tunnel straight through your back muscles and right into your kidney. Through this tunnel, they can use stronger instruments to grab, aggressively break up, and extract those incredibly large, complex stones. It truly is the heavy artillery of kidney stone treatments. So to help you organize all of this in your mind, let's categorize these approaches. You've got your minimally invasive options: observation, lithotripsy, and ureteroscopy. These all rely on your body's natural anatomical pathways or invisible external physics. Then, on the surgical side, you have percutaneous nephrolithotomy, which strictly requires creating a brand new physical tunnel into the organ. This division is exactly how urologists think about approaching your care based on the level of physical intervention required to get you healthy. When you put all this Cleveland Clinic data together, a really clear pattern emerges. Think of it as your ultimate medical toolkit. You can see how the logic flows from the treatment name to the invasiveness down to the mechanism. Smaller stones, up to that 5 to 10 millimeter mark, typically stay in the low invasiveness, watch and wait, or sound wave categories. But as the mass gets significantly larger or more complex, the mechanism shifts forcefully to lasers and direct surgical extraction. Having this clear framework in mind empowers you to ask the right questions and truly understand your options if you're ever sitting in a urologist's office trying to make a decision about your own health. But let's be real for a second. The absolute best treatment on this entire list is the one you never actually have to use. There is a whole world of information out there on preventing these stones, from identifying silent signs of kidney distress early, to flushing your system with the right amount of water every single day, to actively managing dietary oxalates in your food. So, I want to leave you with this provocative question to think about. Now that you know exactly what it takes to get these stones out of your body, from lasers to back incisions, what daily habits are you going to change today to ensure you never have to choose one of these treatments? Keep learning, take care of your kidneys, and we'll see you in the next explainer.